Good morning to all. I'd like to call to order the Town of Hilton Head Islands Community Service and Public Safety Committee meeting for today, January 24th at 10 a.m. Krista, are we in compliance with FOIA?
Yes, sir, we are.
Would you kindly proceed with the roll call?
Yes, sir. Mr. Ames,
Here.
Mrs. Becker,
Here.
Mr. Lennox, Mr. Harkins,
Here.
and Mr. Stanford's here as the alternate.
Okay, thank you, Krista. We have the agenda before us. Is there a motion for approval?
So moved.
Second.
All those in favor, please sign by raising your hand. Thank you. Next, we have two sets of minutes for the regular meeting on November 22nd and a special meeting on January 13th. Is there a motion to approve both at the same time?
Move to approve as submitted.
Second.
All those in favor? So, Krista, do we have any citizens that wish to appear before our committee?
No, sir, we did not have anyone sign up to speak or address the committee today, nor did we have any comments submitted today.
Okay, thank you. Before us today, we have the Community Risk Assessment / Standards cover document. Just as a reminder, this is an essential element in the Center for Public Safety Excellence Accreditation model. And today, the chief is going to provide us with an overview and suggest 3 recommendations. These recommendations will deal with policy and procedures for improved turnout time, to suggest that the chief analyze the call volume and workload at fire stations 3, 4, 6, and 7. And furthermore, it will be recommended to evaluate the current utilization of the fire and medical priority dispatching process. This report is being presented to us to inform and educate town officials, the town manager, and the public on the operations and performance of the department. So Chief, I've looked over your report. It's very comprehensive. It's very lengthy. I'm sure it represents hours upon hours of work with your team. Well organized, and the floor is yours to provide the overview. Thank you.
Thank you. Good morning, members of committee and council. I appreciate you allowing me to speak this morning. So just to follow up on Mr. Harkins' comments, this document is required to be updated comprehensively every 5 years as we go before the commission to become reaccredited. So as you know, the team came in December, and I think the town manager sent you a note. We were recommended for reaccreditation by the peer team that came on site for a week, and we go before the commission, which actually votes to authorize the reaccreditation in the 3rd week of March down in Orlando at their annual meeting. So the site visit was good. They did provide us with some recommendations, which they always do as part of a continuous improvement model, and we take those seriously. So what I wanted to accomplish today was, as part of this process, we updated the community risk assessment and standard of cover. And I think it's prudent that we cover it with council, the elected members, so that you understand how we operate and why we operate based on our community risk. So I've got 25 slides today. You all have a copy, I think, electronically, and a hard copy of the community risk assessment and standard of cover. So my goal today is to walk through the different segments and kind of explain it to you and answer any questions you may have. So is that good, Mr. Chairman?
Yes, thank you, Chief. Please proceed.
All right, I will share my screen.
And Chief, if questions arise, would you like them to be shared during the presentation or after you go through all the slides?
I'm fine with as we go. I'm just going to
Okay,
move through it, and if you want to stop me, that's perfect.
okay. Thank you.
So, like I said, we submitted this in September. Can you all see it before I move ahead? Just
Yes,
okay. So we submitted the document with all the documents that were required back in September. Of course, trying to update this during the pandemic posed some challenges, but we were able to pull it together. And we submitted it, and it was accepted by the peer team and for review as part of the on-site review. So what is a community risk assessment? To try to bring this into perspective, it's where we evaluate our community, and we do it as a community and then with each planning zone. And just to clarify, a planning zone is our station response zone. So we have 7 fire stations, and we look at each one of those zones to define the risk within that zone. And then that risk, and then of course the history of the department, that is how we allocate our personnel and equipment so that we effectively handle the risk. And then within that risk assessment, we look at the services that we provide, which is fire suppression, EMS, technical rescue, and hazmat. And within each of those services, we assign the risk level as a low, moderate, high, or maximum, so that then we can deploy the appropriate equipment and resources to handle the risk. So that's kind of an overview of the risk assessment. I'll get into it a little deeper when we move forward. But that's I always say that's kind of the first half of the document, is you get into your risk assessment, and then you move into the standards of cover in the second half of the document. So what is the standard of cover? Well, you take the risk assessment that you've done, and then you establish your policies, procedures, you distribute your resources, your stations, your personnel and equipment out in the community to effectively respond and to mitigate those risks and to handle emergencies as they come up. So, and what does that do? The little note there at the bottom, it makes sure that we're delivering services consistently across the community based on the risk, that we don't have, in very simple terms, we have one station with a bunch of equipment, a bunch of people, but yet a very low call volume, not much risk. It's designed to distribute and serve the community equally, and then also based on the risk, and then also to meet the standards of the community and what the elected officials want their service level to be. So that's nuts and bolts of what the community risk assessment and a standard of cover actually is. So what I want to do is identify here. So as we talk about reaccreditation, there's 250 performance indicators that we have to write to. And this is an example of a performance indicator. You can see there, it says service area boundaries for the agency are identified, documented, and legally adopted by the authority having jurisdiction. So there are 250 plus of these documents that we, over the period of 21, the spring and summer, that we wrote to send off to the peer team, and they reviewed them. And I put this one in specifically because as part of the CRA SOC, there are elements within that document we have to meet as performance indicators. And this is one where in the beginning of the document, we have to identify that we're legally established and our boundaries are legally established. And this is how we do it. That's just kind of a background to show you the work we do. We have to describe it, we have to appraise if it's working, and then we have to plan for it. So that's just to try to show you the comprehensive nature of what we have to submit. So the CRA SOC, as I refer to it, it's laid out by the Commission on Fire Accreditation. So we follow that model. The topics and the headings here you see within the table of contents are what we follow, and it's laid out for us. And that's what I want to go over today. Is we'll just hit each one real quick and give a little background on that. So the first area that we talk about is defining the community, the area characteristics. And I just put this in here to let you know, we used the comprehensive hour plan and the department budget book and available resources off the internet to define what our community is and how it's laid out. I thought there was a lot of good work done in our plan. Our budget book has good documentation of the community, and I did not want to or feel we needed to go out and try to find new information or try to rephrase it. It's there for us, and it needs to be consistent from the comprehensive plan to the budget to our documents. So we used a lot of information from these documents to help build the front part of the SOC. The next section is description of agency characteristics. This is a little bit about the fire department. And I say this document is written to define to the community, to the elected officials, to the public, our department. And like Mr. Harkin said, it's comprehensive and it's rather lengthy, but there's a lot of information in it to explain our department and how we operate. So one section that we put in there is the characteristics of our department, which is, you know, some history, some milestones we've achieved, you know, how we our command and control chart, how we're broken down the different divisions, EMS, training and operations, administration. And then we cover our stations, deployment, our apparatus, and how we staff our department. An example of that, if you see there, fire station number 1, shipyard. As part of defining the agency, we put this information out there. We give a little summary of the station. We show it on a map. We give some geographical information, and then you can see we break down equipment located in the station, some call data within that jurisdiction over the last 5 years, and some incident by service area, which is our fire and EMS. And then on this chart at the bottom, I just included fire and EMS because our hazmat and technical rescue are low frequency calls, so I did not include them in the chart. But we did this, as you could see, for each fire station over 5 years to highlight the equipment and give a general description of the station and information on the department. So the next area we talk about, so we've covered the community, we've covered our agency. Now we're going to start into the risk assessment model. And we did this a couple different ways. One area was occupancy level risk. And this is to look at the building stock and what type of buildings are they, and then are they protected? Do they have fire protection systems? The chart, you can see obviously the assembly and education and business and a lot of those type with it are considered higher hazards because of the number of people in there, children, you know, in education facilities and things like that. But a lot of those are protected. So meaning they have smoke and fire alarm systems and sprinkler systems. So as we look at our community, we broke down a lot of the information from our buildings, and you can see we plotted it out on the charts to show a rating based on the base rating, and then we applied adjustment if it's has a fire protection system. And then we plotted that out on the map that you can see there. So it's kind of looking at what the, you know, community risk is looking at all the risk in the community. Well, the buildings and where people go contribute to that risk. So then we did the building stock, and then we also took each planning zone, and this is a comparison slide to try to explain how we did this. So this is station planning zones 3. This is the fire station by the church up at Port Royal, and fire station number 4 at the back gate of Hilton Head Plantation. So the risk management, risk assessment model here, what we apply is the probability of occurrence. We do community consequence and then the impact. And what we do is we plot that out using a formula that's generally accepted by fire service across the country. And you can see as we lay the model out down below, the fire risk in the red triangle, the EMS, and then we also have hazmat and tech rescue, but they're low. So if you focus on the red and green, blue triangle, sorry, what I wanted to show you was that our risk is very consistent across these 2 planning zones, and they are really, if you look at the document, across all 4. But if you notice, the EMS moderate tips toward a higher number at the fire station number 4. And, you know, that's reflective of the call numbers in that location at the back gate, because You have the Cypress community there that's impactful on an EMS response. And then you also have Bayshore now, which has really increased the call volume there. So that model, that risk assessment trends to what we're seeing as a moderate level EMS risk. And part of that is that the call concurrency can come up. If we're busier in that area, the likelihood of getting more than one call at any given time increases. So that's where we'll get into looking at staffing a little later. So that's just the risk assessment. You also can see there we plotted the buildings based on risk up there in the map. So any questions on that before I move on? My goal was just to show you the method we do the risk assessment and how it compares in the different jurisdictions.
Chief, since Bayshore has opened, can you quantify the increase in calls compared to the time before when it was not open?
We can. I don't have it in front of me. What we're working on our calendar year 21 data now to come back to give our annual update. But in the first half of 21, we were averaging a call to Bayshore one every other day, based on, not that we were responding every other day, but if you looked at the number of calls over 6 months, it averaged out to almost every other day we would run some sort of an emergency there. It could be a fire alarm, but it was primarily EMS. But we can run some numbers. We definitely see that fire station, as you look at the pie chart of our 7 fire stations and the workload based on incident response, the shipyard and Hilton Head front gate have always been the highest. The other 5 were pretty equal, but we're seeing the trend up now of the back gate of Hilton Head Plantation. And that's why we're moving to say, well, at some point we're going to need to staff that station with 4 personnel, 2 and 2, where we can split the engine off. The fire risk is relatively low, as it is across the island, and that's why we've been able to cross staff our units. They take the fire truck when they need to, or they take the EMS medic unit when we need to. You know, certainly that saves on staffing costs, and staffing costs are a big part of our budget. But we're seeing that trend at that station where we need to upstaff it like we have at the front gate of Hilton Head Plantation and Shipyard and Station 2. We'll run some numbers, and when we come back for our annual presentation, we can do that.
Yeah, I don't want to get involved in a detailed conversation, but the population at the Cypress is larger than at Bayshore, and the medical platform at Cypress is more robust than Bayshore, yet Bayshore is smaller, and it's calling for more intervention. So something's going on there that I think should be looked into.
I have a question, if I might.
Yes.
Chief, would you go back to the 2 or 3 slides before, the slide that shows the entire island? Yes, this one.
Yeah.
It looks to me like the intensity of these incidents is right along 278, Marshland Road, and a few others. What do we learn from this concentration of incidents or events as indicated on this map?
Well, this shows your single family homes aren't included in this model. So this is all your commercial occupancies, and that's why you see they're your commercial buildings, they're your restaurants, they're your apartment buildings, but your single family homes are not included. If you look down at the toe of Sea Pines, that area down there would be the Salty Dog Complex. The little cluster up and down in Sea Pines over there would be the Harbor Town Complex, with the commercial buildings, things like that.
Yeah, your explanation that it doesn't include residential answers my question. Thank you.
Yep. So as part of risk assessment, so we've looked at the community, we've applied a model based on our call concurrency and impact and other factors. So then we break it out into, okay, what services are we authorized to provide? We provide fire suppression, emergency medical, paramedic transport, hazmat, and technical rescue. So those are the 4 service levels we're evaluated on through the reaccreditation process. Some departments have wildland, just to kind of expand upon it. Some fire departments provide aircraft firefighting, rescue, airports, wildland, and some do marine firefighting. Even though we have a lot of marinas, we do not marine firefight by the definition of what some fire departments do. So when it comes back to our data and how they're evaluating us as a fire department, they look at these 4 services that we provide. So then for each, so as we continue through the risk assessment model, for each service level we provide, we identify what is low risk, medium risk, high risk, and sometimes maximum risk. For EMS, we only did low, medium, and high. For fire, we did low, medium, high, and maximum, because we do have some structures which tax our ability as far as resources, that we need to get enough people on scene during the first initial response that we can control that, so that it doesn't continue to grow and get out of hand. Where with EMS, based on how we operate, we only use low, medium, and high. So you look at the services you provide, and then you assign the risk level. And then off of that, you then assign your critical tasking. And this gets into what the amount of personnel we send based on the call. We're going to send less people to a low risk event than we are to a high risk event. And that's what you do in this model. You then take each service and each risk level and you apply tasking to it. The effective response force is the total number of resources outside of a single unit response. And I'll use cardiac arrest for an example. We send the closest ambulance to a cardiac arrest. We also send the next closest fire unit, and we also send a 3rd unit. So to get the ERF there of 7 people, we may end up sending 2 to 3 units. And we measure that effective response force on a cardiac arrest when that last unit arrives to determine if we're meeting our standard. So the critical tasking and effective response force comes at the end of the community risk assessment. And here's an example. I included these to kind of highlight. It's easier to see the chart and understand it sometimes than it is me explaining it. So for a low, I use medical, that's 75, 80% of our call volume at fire rescue. And if you see there, we identified a low as 2-person response. A moderate risk would be 4-person response, which might be an ambulance and a fire company, or 2 ambulances, depending on the location. And then, as I just explained, a cardiac arrest, where we send based on that type of response, we want to try to get 7 people there to effectively handle that and resuscitate that person. So then we get the first out medic unit that's closest, and then we send the next 2 closest, and then we also send the battalion chief to take control and help coordinate that response. So that's how low, moderate, and high is applied to our EMS service level. Do the same thing for critical tasking for fire suppression based on the risk. We have low risk, which oftentimes is a fire alarm, smoke scare, smoke odor, something where it's a low risk based on the call information. We send out 1 unit with a minimum of 2 persons. They may get 3, just depending on staffing. But as a minimum, they're going to get 2. And if you look at the next, the cooking fires, trash fires, passenger car fires, the moderate risk, we want to send at least 3 people to handle that. We move on up to a high risk, which is for us, the high risk is a residential structure fire. So to effectively send the units from across the island to handle this type of a fire based on our tasks that have to be accomplished on scene, the critical tasking there you see, we want to get up to 14 people through that first response. And then on the right, you can see the responding units and how we assign the staffing to that, engine, truck company, medic, and how we achieve that. And then, as I mentioned, the last chart there is your maximum risk, which is these are our commercial fires, apartment building fires, where we're going to send up to 17 people on the initial response to try to get control of that situation. So that's how, so we take the community risk assessment, and then we apply our staffing based on those different levels, low, medium, and high, or maximum. And that's how we come up with our deployment model. The next section that comes up is the community feedback. The accreditation model is always asking the department what they're doing to engage their community, to understand what the community expectations are of the department and how we can serve that. So here we just listed a few things we've done, obviously, through our strategic plan to get internal feedback. We did a community communication survey with the change from the old newspaper being delivered to the door to the electronic communications. How are we communicating with the public to get our message out there? We can do EMS patient surveys. And then we're currently working to implement this year a customer service survey using technology, the QR code, that will allow people to quickly scan their phone to the QR code, and they can go in and provide feedback on our service levels. So we're always trying to engage the community and maintain awareness of where we're at. The next section in the CRA SOC, they ask you to do your program goals and objectives through our annual appraisal process. Every division in fire rescue, as part of this model over the last 5 or 8 years, we do an annual appraisal. Operations does an annual appraisal. The Fire Prevention Bureau, communication centers, and that's simply sitting down, looking at the goals we established for the calendar year and saying, did we meet the goals? What was our statistics? A lot of different information in there. And we also budget goals, strategic planning goals. And it's just a way for us as a continuous improvement model. We set goals every year. Well, the appraisal is to go back and look at the goals and say, okay, how did we do? Did we teach as many CPR classes as we had hoped to? You know, a lot of different data out there, a lot of things going on. And the annual appraisal is the process used to kind of collect that, make sure we're staying on target. So now, to me, the document moves into the standard of cover now. So we've done our community risk assessment. We've identified critical tasking. We've laid out our response model on low, medium, and high risk. So now what we do is take our deployment and we say, okay, let's benchmark. We set our standards of what we want our response times to be, and then we measure it at the 90th percentile. I've presented these charts over the years to show our performance. They do it. They don't. An average is not reflective of true performance because it can be swayed. So the commission uses 9 times out of 10, 90th percentile. So we set our benchmarks and then we measure that. And then part of that is using the 90%. It excludes outliers because there can be system stress at times. You want to look at your response day in, day out over several years, over a lot of calls to say, are we on target? Are we serving the community within our response time standard consistently? And this allows you to compare our standards, as I said, each year with our actual response data. So this data, as I told you, we're working on 21 data. We're going to come back and provide these same charts in our annual report to you, probably in March, I think. But this data goes up through 2020. We did not include 21 because we were working on the document. We had to get it submitted. So I'll just give you the chart identifies the 5 years across the top. Our benchmarks are on the right-hand side as you look at the chart. And then down at the bottom, we do the gap analysis, which is the easiest way to look at it. Is we have a benchmark of 805 for a first due on an EMS moderate. Okay, so we ran the numbers and we actually beat that by 2 seconds. Our numbers show about 8 minutes and 3 seconds for total response time. So the green number, which is good, green for good, is 2 seconds better than our benchmark. And then you look at the ERF, which is red, and that's 45 seconds over our benchmark. But that's because in an EMS response, there were 4 people assigned to that. The first due is going to be the closest unit, and they're typically going to get there close to our benchmark. The challenge we have, and many fire departments have, your next closest unit, as for us, is going to be the next station or the next apparatus, wherever it is, but it may not be necessarily within that jurisdiction. It may not be in that station planning zone. So that unit's coming from a greater distance, which takes them a little longer to get there. But they're still getting there within 45 seconds to support that first crew. So that's kind of a summary. I presented these, I don't want to move too fast, but we measure alarm handling, which is from when the call is received until they send it to the stations. The turnout time is from when the crews in the station receive the call until the wheels are rolling. Travel time is that time from when the wheels are rolling until we arrive curbside. And then the total response time is that time, including all those time segments. So as part of the accreditation model, we have to provide these charts to the commission to show we've established our benchmarks and that we're measuring our performance so that we can determine if we're meeting what our goal is, and if not, how can we improve?
Chief, how does our turnout time compare to other communities? Do you have data on that?
Yeah, turnout time is one of the more challenging segments to achieve for a lot of departments. There's several factors that could be there. Obviously, at night when the crews are not up and around, it takes longer to get out the door, so that makes the number change. Sometimes there's other factors that could slow it. We're working on it. We put up clocks in the bay, a time clock that starts the countdown as soon as the call in the station is received, and then it counts down, so when they come out to the vehicles, they can see where they're at. I would say we're along the lines with a lot of departments that report it honestly. There's always ways, some departments that will say they have very low turnout times, which just based on what I know about having to move through a fire station and get a vehicle rolling seems hard to accomplish. But we've targeted this and we'll cover it at the end, to continue to improve this. One technology factor that we're getting ready to address is the delay from dispatch to the fire stations. Based on our current technology, which is outdated, it takes almost 20 to 30 seconds when multiple units are dispatched for that signal to reach. And that's just improved technology based on what we have. So there's national standards out there, and we're not where we want to be, and this is a focus we're going to have going forward, but we're not. I've seen departments with turnout times that are higher than these.
Thank you.
So I jump to the next slide. So this is high risk EMS. This is primarily our cardiac arrest response. And you can see on going down to the bottom, first due, very, very good with the benchmark. We're in the green there. And once again, for all the units to get there, we're in the red at a little over, but you want to meet your benchmark, but there's also just realistic considerations of when you're sending multiple units from different directions on the island. It takes a little time, but we've got a good benchmark and we're giving good service, and we want to continue to monitor it. I didn't mention, if you look, the N number, just so for clarity, that N number is the number of responses that are included in the chart. And those are only emergency response, meaning we run lights and sirens the entire way. If we drop down to a non-emergent response based on feedback we get from the dispatcher, then the call is not included in this response data.
Chief, I have a question with regards to the EMS response time. As traffic increases on the island, are we likely to get to a point where you're concerned with that red number growing too much?
Well, yeah, that's certainly a consideration. We've implemented, the traffic preemption system. We've implemented emergency access gates over the years. We've done a lot of good things as a community to support the total response. And by total, I mean more than just the closest unit. But yeah, as you know, traffic is certainly a factor. And that's the good thing about this model, I think, is as we measure this, we can see whether or not we're trending in the wrong direction or not. I think our numbers have been pretty consistent over the last several years. And I don't know what the traffic counts are on Hilton Head, but I think it's always a consideration. We've got to get there safely and as quickly as possible, but safely. But yeah, I think this is the information we need to consider that.
Thank you.
So to look at our fire response here again, this is moderate risk. So this is typically 1 unit responding. We have pretty good times there. Our benchmark is 8 minutes and 50 seconds. And for this data set, we were in the green. And since it's typically 1 unit responding, our ERF was right there too. So occasionally we do have to send 2 based on our staffing model, but in this case, we looked good. So this would be your typical, this would be a residential house fire. You can see our benchmark is the same. We want that first unit, regardless of type of call, to be there at the same benchmark. And we're just a little over with the first arriving, which is good. And then, of course, as we've discussed, related to Mr. Ames' comment and everything, the ERF, when you've got several units coming from different directions on the island, the impact of getting there can slow us down. So we're over that. And of course, we calculate this. There's 57 calls in that data set. So those were house fires where the total response force arrived. We measure it, if the first engine gets there and it's burnt food on the stove and they cancel the other units, then that would not count in this data set. It would count on the first due, but it would not count in your ERF, which when you're trying to get the 14 people there. And then here's our commercial fires, the apartment building fires. You can see there again, the first due, pretty good numbers, got us in the green, somewhere between 8 and 850. And I think that's a good response time for our community. And then to get the extra units there, because you're sending more people, more units from further away, your gap is still at 139. So we've got, and those 2 charts, it's interesting because the single family homes, as Mr. Stanford pointed out, if you look at our commercial occupancies, they kind of generally follow our road corridor with some pockets, as I mentioned, Harbortown, places like that. But so being that that's our commercial response, our ERF can possibly get there than a house fire at the very back of Hilton Head Plantation or the very back of Port Royal, where the last arriving ERF, the last arriving apparatus, is got to go even further to reach back to get to some of those residential areas. So that's how I look at that number being a little bit different.
Chief, I have 2 questions if I can ask real. So you bring up 2 things that are interesting to me. When we talk about commercial, some of the residential commercial buildings, I'll call them, are being built having to abide by all the fire standards with sprinklers and everything that's included. And that usually that's based on the number of stories that the residential commercial buildings are being built to. Are those included, those that are built to those standards, are those included in your numbers for commercial buildings? Or are those included in the numbers for residential homes?
Well, they would be included in the data set as the response. Is that? So they would be included.
Okay, well, okay. I was just interested in whether or not they're included as a commercial building or if they're being built, added in as a residential home. And I guess that question I can tease out later. The other question or comment really that I have is, in terms of the response time, how much, if any, is that? You mentioned communication, and to me, thinking this through, how important is the alarm systems that have that are tied to a call center that notifies you versus those homes that have fire alarms where it requires the individual to wake up or to be notified and then make the call out to y'all? Has that been teased apart in terms of seeing how significantly different how much difference that makes for y'all to be able to have a response time that lowers your closer to your benchmark? Does that make sense?
Yeah, that from the time the monitoring station receives the notification until they call us, it's hard for us to measure. The key factor is the building occupants are being notified, so they can make the call or get out of the building in a dangerous situation. It's hard for us to calculate what that time is.
Yeah.
I mean, we can sometimes on actual fires, we can talk to the occupants and we know what time they called us, and they can kind of tell us how quickly they heard it and made the call.
Yeah.
Some of the fires, obviously, that happen at night, when if someone's not there, you know, they tend to be fires that are further along in involvement of the structure when we get there, based on middle of the day fires where everyone's up, moving, awake, and people see, everybody carries a cell phone, so we're getting quicker notification. I can talk to Joe Hyde. I don't know how we would factor in. We know there's, from a commercial building, to answer, I think, one of your questions, we're considering an apartment building a commercial building based on our response model.
Yeah.
Compared to a single family. But to try to figure out how long it takes for the alarm company to notify our dispatch center, I don't know. I've never found a good way to do that. And
I was just wondering.
Delay.
I was just wondering what factors really go into all of this. I personally know that you guys do a great job in your response time, and you're amazing. Just thinking in the big picture of all of the different factors and where there might be some help that could be led your way in terms of making those benchmarks easier for you to meet. But in any case, thank you for the information.
Thanks. So I think as we kind of finish up here, as part of, so that's a walkthrough, and as you get to the end of the document, what the accreditation process requires is for you to look at your response data, to look at your community, look at your risk assessment, and say, okay, how do you maintain or improve your response capabilities? And, you know, for a department out somewhere where they're annexing and growing, a city is growing, obviously the deployment would be considering where you're going to put more fire stations as the community grows. Well, for us, being our type of community and where we're at, you know, we've got good station deployment. So it's kind of zeroing in on saying, okay, we've got good benchmarks and we're doing okay, but how can we continue to improve on those? And so to Mr. Harkin's point, we laid out some goals here. One was to look at our turnout times and continue to work on those. We've got some new software coming in, reporting software. We also, as I mentioned, the station alerting system is in process to be replaced, and we're using probably, I don't know, 20 or 25-year-old technology there. It's basically not supported any longer, so we're at that point. And then our cross-staffing model, back, you know, 25 years ago, when we implemented this staffing model, it worked very well, and we were able to handle the call load and the call volume. But we're getting to that point as the island's grown and development has occurred. More people moved here, more communities for the elderly. You know, we have to look at the stations that are still just staffed with 3 people, and they cross staff from a medic to a fire truck. Is it time to put another person in that station and make it a 2-and-2 response where they're a little more independent? We also want to look at the dispatch determinant, on how we dispatch our medical calls, making sure we're doing that in a manner that gets the efficient, so that we're not over allocating too many resources to a lower priority call. So there's some things we can look at there. And then one aspect from the commission has always been, there's got to be a compliance team. You can't put the work into this document and your accreditation process, submit everything, be accredited, and then walk away and just give up and not continue with the process. They encourage and require that it's a continuous improvement model. This document is a foundation for that, along with your strategic plan, along with your budgeting documents. So we continue to look ahead to the future on what we can do. In this document, we're looking at deployment of resources and response capabilities, where our strategic plan touched on other goals and objectives for the department outside of just emergency response. Our budget document looks at fulfilling the needs of replacement of equipment and other things. So this is a good document to say, okay, just looking at our response capabilities, where are we headed, how are we doing, and where are we headed? So with that, that's an overview. I didn't want to get too far down on it, down in the weeds, but I wanted to give you an overview and try to help you understand the process and what we're doing and why we operate and handle various calls various different ways. So I hope that was helpful.
Chief, thank you very much. I'd like to turn to the committee members now and your comments or suggestions. Alex, could we begin with you, please?
Yeah, thank you, Mr. Chair. Good morning, Chief. How we doing? Great report as usual. I know a lot of time and effort goes into the accreditation process. I guess my question, I've got two. I think the last time you gave us an annual report, I may have asked you about the areas on I guess Hilton Head or Jenkins Island that are not incorporated into the town, like Windmill Harbor. We have a memorandum of agreement with Beaufort County to service that area. Is that correct?
No, we don't have an agreement with them. We have a mutual aid agreement with Bluffton Fire, but we do not have an agreement to service that area except for 278, which is within the town limits. But Jenkins Island and Blue Heron Point and Windmill Harbor are in the county, and they do response.
Okay, so we don't respond to those areas.
Not as a matter of first response. If Bluffton Township calls and requests help, or Beaufort County EMS, we're going to go, but we are not dispatched. Several years ago, there was a contract where we provided services to that area through a county contract, and they paid the town, but the county elected not to continue with that.
So if there is a case where we do have to respond based on requests from Bluffton, is there some type of reimbursement process?
No, countywide mutual aid is we all help each other. If they need help, we send, and same with Beaufort County EMS. It doesn't happen very often, but occasionally, if they're taxed out in Bluffton, whether it be a bad wreck or a fire or something, and they need coverage, we'll send a unit over just to stand by. Typically kind of Moss Creek and this side of their area. And likewise, if we get in a bind, get low on resources, we'll call them over. Typically happens maybe 5 times a year, 5 or 6.
Sure. Okay. And I think it's loud and clear that you're doing all that you can to improve your level of service. And one means of doing it is through upgrading technology. You mentioned staffing throughout the presentation also. Have we gotten a handle on our percentage of fire and rescue staff that are currently living on Hilton Head?
Do we know the number, I guess?
Yeah.
Is that?
Sure.
I don't know if we've checked lately. It was somewhere, Chris can help me here. I think the last time we helped through HR, the number of living on the island was 30%.
Yeah, it's about 34%, but we have not done it probably in the last year and a half. HR usually runs that. I think it's probably lower now. But we can run that. I could get that this week.
Okay, I know that that's not necessarily a part of the accreditation process, Chief, but I continue to beat that drum because we are taking housing very seriously here on Hilton Head, and your accreditation report speaks very loudly to us trying to accomplish the goal of excellence, right? You know, 34%, there's nowhere near excellence in my mind, right? So for a benchmark for us as a town internally, improving upon that number, I think will definitely help your situation regardless, right? So I just want to keep that in front of all of us as we move forward, okay? Those are my questions. Thank you, Chief, for being so professional in your presentation and all that your staff does. Thank you, Mr. Chair.
Thank you.
Thank you, Alex. Tammy, please.
So I asked the questions that I thought were the most important to me at the moment. I think that one of the things I was trying to get at with regard to some of the residential homes that are used more as commercial buildings or actually built under a hybrid of commercial residential codes requiring fire types of apparatus being built throughout the home and how that's classified in your reports. But in terms of what y'all do, yes, I see. Yes.
Ms. Becker, I have an answer for you there. So we are working towards in our CAD implementing square footage for our single families. So we will be dispatching any single family over 3,600 square feet as a commercial, as we call it a max response, but that would be the same response as all commercial buildings, all multifamily residentials, and any single family homes over 3,600 feet. So we're working with the building department to get those square footages and get them implemented into our CAD. That was a great answer. It's exactly the information I was looking for. Thank you so much.
Thank you. David, please.
Thank you, Mr. Chair. Chief, as always, congratulations. Good job. I was impressed with the sophistication of the analysis, the breadth of it, your presentation and the substance. So good work. I was also noted, and you emphasized this in your comments, of the almost ideal location, central location of the fire stations within the districts. I'm sure that's not by happenstance or happy accident, but I think it makes a lot of sense and probably is critical to the response times that you cited. Question, stations 3, 4, and 5, and perhaps 1 to a degree, had higher risk factors. Do you solve that problem? I'm making this an assumption problem with technology, people, equipment. How do we change those risk factors?
Well, I think the risk factors based on our island and how the zoning is in those areas, I don't see the risk factor changing a lot as far as, you know, we're not going to have a significant increase in high hazard occupancies or things. It's going to be based on the call volume and then call concurrency. So therefore, if we start to see one area that one station planning zone where we're not meeting our benchmarks repeatedly and we're seeing more times that the public's waiting on us to get there, you've got to adjust your staffing. I think the stations are in a good location. The risk based on our community, and it hasn't changed a lot over the years, is going to stay relatively consistent. I mean, there are risk mitigation strategies, public education, and other things. You know, the fire codes are a risk mitigation strategy. When new buildings go up, they're required to have a sprinkler system if they meet the code, things like that. So I think to maintain that level of risk is a good a good desire, and then obviously implement mitigation strategies where we can. But in the end, it'll come down to if we have a level of performance and we're not meeting that, then what can we do? I don't think we need to add fire stations. Probably we're going to need to add more people so that the response times maintain consistent levels. Does that?
And do those risk factors by area affect insurance rates within those areas?
Not to any degree. We went, through our ISO assessment, and we improved our rating, but basically the way the insurance companies work and what information I got from some members in that field, that unless there's a dramatic increase or decrease, that basically our department, our codes, our response model is going to keep the rates relatively consistent.
Thank you. The bottom line for me is that your report is confidence building, and I appreciate that and the efforts of your entire staff and units. Thank you.
Thank you.
Thank you, David. Tom, please.
Thank you, Bill. Brad, great report as always. I continue to be comfortable and confident in virtually everything that you do and the way you do it. Good job. Brad, I do have two questions. The last time we talked about the numbers coming from 2020, there was very definitely a pandemic effect in the turnout and response time. Is that still the case, or is that filtering through the system now?
Well, we're running our data for 2021, and all of the response procedures where we slowed everyone down in 2020, we slowly went back to normal on our turnout and response model from what we used to just in one unit and everybody stayed outside. Very protective, very slow response. So when we get to 21 data, it'll be interesting to see if we've made improvements.
That sure will. It's very evident in the 2020 data. Second question, Brad, is the development of the Christian Academy apartment complex and the ultimate occupancy of those 250 or so units in this year's risk assessment. So what kind of effect does it have on your planning?
Well, it's not in the risk assessment this year. It'll have to be considered in the future. And I think that goes to Mr. Ames's point. As development occurs, how's it going to impact our risk level? Well, from a fire protection standpoint, and those buildings being built to modern codes, we would hope the fire risk is still relatively low. But you add the occupancy of people in there, and the call volume could go up. You're going to probably have fire alarms there. You're going to have some other type responses to the apartments, but you're also going to have EMS responses, and we're already seeing that risk in our community just based on call concurrency and the call numbers. Call volumes go up. So there again, that location is really on the border between Fire Station 3 Mid Island and the front gate of Station 5. At the front gate, Indigo Pines in that area is Fire Station 5's first response, but obviously the other fire station can get there very quickly. To Mr. Ames's point, you also have at the back gate of Hilton Head Plantation across from Bayshore, at some point, I think there's a plan to build another facility there of some sort. I don't know where that's at, but that'll certainly impact the response to that station. And as we look at the risk in EMS will certainly go up just based on the number of calls to that location. And that questions, is our response times remaining consistent? Are we still providing a good level of service?
Good, thank you.
Thank you, Tom. Glenn, please.
Thank you, Bill. Chief, congratulations to you and your department for an outstanding report. I feel very safe and well served here, thanks to your services, and I sincerely appreciate it. A few years ago, I remember that you gave some statistics that showed that our cardiac response rate here was much better than the national average of that. Is that still true? And do you have any of those statistics available?
I don't have it today. We're going to update that as part of our year-end review. We go back and look at calendar year 2021 to give you all our data. And that's what we'll bring forward in March, I think. I'll schedule that with Mr. Harkins for our annual report. We're still very good, I think. I don't know what the numbers are. We did with the pandemic have a decrease with slowing down like that. You know, intervention is very important on a cardiac arrest immediately, especially on a witnessed, cardiac arrest. But because of the pandemic and the factors around that, it did slow the response. Obviously, the public wasn't out like it was. So we still have a very good response model, but let me get the numbers and we'll see where we compared to past.
Excellent.
But yeah,
Excellent. I certainly understand the effects of the pandemic, but it was clear previously, and I'm sure it's going to be clear into the future, that we have much better cardiac response here than the average community, and we're grateful for that. Thank you, Bill.
Thank you. Chief, from my perspective, the resources that you have, the systems that are in place, the highly trained staff, and the performance metrics that speak to substantial quality in terms of performance, I would submit are probably the envy of many communities throughout the country. That said, from my perspective, how could we capitalize on this more than we are? For example, how are we sharing this good news with the public? How are we sharing this with the real estate community that deal with people thinking about coming here on a permanent basis? How are we sharing this with the Chamber of Commerce that deals with the business community, keeping them here and encouraging others to come? And in terms of economic development for people that are scanning the environment and looking at the resource base, this certainly, you and your team and your department are a true gem. And maybe not to answer in depth today, but I would like to see some thought translated into a real marketing plan that shares the good news, maybe more than we're doing today. But your comments, thank you. And great report.
no, I appreciate that. I think we've challenged ourselves too. How do we market ourselves? And we got to handle the day-to-day stuff, but how can we improve on selling that message? So I appreciate those comments.
Right, and some of the resources or the entities I mentioned could be extensions of your department in terms of marketing the good news. So something to think about for the future. Okay, any other comments?
Can I add just a quick comment? I just wanted to thank my staff. This is a team effort. This was a very comprehensive document, a lot of work hours, a lot of stress. The entire team out there over 2021, if you think back, we were getting vaccinated and doing testing at the hospital all last spring, and we thought we were on a better road, through May and June and July, only to have the Delta. And then so there's certainly a little COVID fatigue out there amongst the crews and everything we've been through, but they do a great job every day, and I appreciate what they do and our dispatchers do, and the entire team, the administrative support I have. So I always want to give them a shout out. It's all based on their support and what they do.
Yeah, certainly a team effort, and extend our thanks to your entire group.
Thank you.
If there is no other business coming before the committee, is there a motion for adjournment?
I'll make that motion.
Good. All in favor? We stand adjourned. Thank you, committee, and in particular, Chief, thanks for all your excellent work and the work and efforts from your.
Thank you.